It feels like a heart attack, but it's not. By Robert Autry, MD, MSc. Welcome back to Hearty Health MD. What if your chest pain gets worse when you lie down, but better when you sit up? That's not typical for a heart attack. It could be something called acute pericarditis. Let's break this down. What is the pericardium? Your heart is not just floating freely. It sits inside a protective sac called the pericardium. This sac has two layers, an inner layer that sticks directly to the heart and an outer layer that surrounds it. Between them is a small amount of fluid, about 50 milliliters. This fluid reduces friction so your heart can beat smoothly. The pericardium also helps keep the heart in position, protect it from infection, and control how the heart feels. So what is acute pericarditis? Acute pericarditis happens when the sac becomes inflamed. When that happens, the layers rub against each other. This causes pain. It can also lead to fluid buildup around the heart called a pericardial effusion. In fact, this happens in about 60% of cases. So what causes this? The most common cause is a viral infection, often after something like a cold or flu. In many cases, we don't find a cause at all. Other causes include bacterial infections, tuberculosis, autoimmune diseases, cancer, and certain medications, especially herbal-based supplements that may be contaminated. Note that acute pericarditis is common in men and can happen at any age, but the risk is higher in men aged 16 to 65 years. Also important, about 15% of patients have inflammation of the heart muscle too. This is called myocarditis. Now let's talk about symptoms. The main one is chest pain, and it shows up in over 90% of patients. But this pain is different. It's usually sharp and stabbing. It gets worse when lying down and when taking deep breaths in and out, and gets better when sitting forward. It may spread to the neck or shoulders. Other symptoms include shortness of breath, cough, low-grade fever, and sometimes even hiccups. So how do doctors diagnose it? You typically need at least two of these: chest pain or a specific scratching heart sound called a friction rub, or changes on an EKG, which assess the electrical activity of the heart, which can show patterns that are suggestive of heart inflammation or injury, or fluid around the heart. Doctors may also use an echocardiogram, an ultrasound to assess if there is fluid around the heart, or blood tests like CRP to check for inflammation, and sometimes imaging scans like CT scan or MRI to look for more detail. The good news? Most cases are treatable and go away. Treatment usually includes anti-inflammatory medications like ibuprofen or aspirin, and a medication called colchicine, which helps manage inflammation and prevent recurrence. We also use a class of medicines called proton pump inhibitors like pantoprazole to protect the stomach while patients take high-dose NSAIDs like ibuprofen. Most patients improve within 10 to 14 days, and steroids are used only in special situations. Rest is also important. Avoid intense activity, especially during the acute episode, until symptoms are gone. But in some cases, complications can happen. Fluid can build up and put pressure on the heart. This is called cardiac tamponade, and it's an emergency. Some people may also have recurrent pericarditis, or rarely, a long-term condition called constrictive pericarditis, where the heart becomes stiff and can't feel properly. Constrictive pericarditis can also lead to heart failure, particularly of the right side of the heart. So here's the key takeaway. If you have chest pain that changes with position, don't ignore it. It may not be a heart attack, but it still needs attention. Understanding conditions like pericarditis could protect your heart. Thank you for watching. To learn more and live healthier, find us at HeartyHealthMD on YouTube. If you found this helpful, please like, share, and subscribe to support your heart health.